What is the number one thing that you can do to improve your health and prevent disease as you age? Hey, I'm Priscilla. I'm your Houston, Texas nurse, and I'm going to help you take action today for a healthier tomorrow. The number one thing that I think that you should do is you should focus on decreasing insulin resistance in your life as you age. The reason is that all of the top killers, whether we look globally or in the US specifically, they're all linked to insulin resistance. Insulin resistance, a lot of people only associate with prediabetes or type 2 diabetes, when in reality, insulin resistance alone leads to chronic low-grade inflammation. And you might know that chronic low-grade inflammation is the common soil to every health crisis that people experience as they age. So today I'm going to tell you what is insulin resistance, why you should care, and what we can do to decrease it in your life, especially as you age. Just as a backstory, why do I care about these things and why should you care about these things? My father suffered an ischemic stroke in 2019 and he can no longer move the left side of his body. And then my mom last year in 2023 was diagnosed with stage 4 cancer and passed away 5 months later. Those experiences, alongside my experience of being a bedside nurse I worked in a hospital for about 12 years, have opened my eyes to the power of taking action today for a healthier tomorrow. And that is my passion. Whether you are trying to focus solely on blood sugar balance for your life right now, whether your focus is weight loss, or whether your focus, like me, is to decrease disease in your life as you age, I want you to know that decreasing insulin resistance in your life is the way to go. So let me just tell you a few things about insulin resistance that you may not know. Number one, it's estimated from the internet says that 1 in 3 Americans have insulin resistance. That's bogus in my opinion. I would say it's much higher than that, especially with the projections for people having type 2 diabetes. Insulin resistance, you may not know, it doubles the risk for depression. Most people think of insulin resistance as, okay, well, let's fix our blood sugar control. Well, really, what we need to do, it's also going to impact your mentality and your risk for disease mentally. Being insulin resistant alone increases the risk for stroke in non-diabetic patients by 60 to 160%. That means you do not have to have a diagnosis of type 2 diabetes or technically even pre-diabetes to have an increased risk for a stroke. You only have to be insulin resistant. That should put a fire under everyone's incentive to decrease insulin resistance in their life. That's in non-diabetic patients. Maybe you've seen commercials where they're telling type 2 diabetics, you better fix it, take this medication because it's going to increase the risk for stroke. Well, actually, that's not the only thing. People who aren't diabetic but are insulin resistant need to make sure that they are decreasing their risk for stroke by fixing insulin resistance. Okay, it increases the risk for cancer, insulin resistance, because it is associated with the progression of cancer. Meaning, if someone receives a cancer diagnosis and they are very insulin resistant, they will see a faster progression of cancer. And 2 other things about insulin resistance you may not know. Insulin resistance is linked to high blood pressure. High blood pressure is known as a silent killer because people can have it and not know that they have it. Then it can lead to things like heart disease and stroke. And then finally, insulin resistance has a huge impact on infertility. So a lot of women are experiencing infertility. A lot of men are having poor sperm health or low testosterone at very young ages. Both of these things are linked to insulin resistance. So no matter your age, no matter your goals, we should all be thinking about insulin resistance. So let's talk about what exactly is insulin resistance. So what is insulin? Insulin is a hormone produced by your pancreas. And what insulin does is it helps to move glucose or sugar out of the bloodstream and into our cells where it can be utilized. When you go get blood work done, a lot of times they will check your fasting blood glucose level. That number tells us your glucose level in your bloodstream. We want that to be a normal range, And we want that glucose to be utilized as energy. And in order for it to do that, it has to come into the cell. And so you have to have insulin in order to get that glucose into the cell out of the bloodstream. That's kind of confusing. Even in nursing school, I found that to be kind of confusing. The difference between sugar or glucose being in the cells versus in the bloodstream. There's a difference. And so here's a great example. If a type 2 diabetic has high glucose, high blood sugar, let's say we check it and it's like 200, what we do, at least in the hospital what we did, is if they're insulin dependent, we would give them an injection of insulin. That insulin then would lower their blood glucose level. We check it again in like 30 minutes, and their glucose level should have come down if they received the right amount of insulin. And so that's what insulin does for us. It moves glucose from the bloodstream into the cells, and it can be utilized as energy. The problem is when that insulin is not as effective at doing its job. You should think of insulin as a key that goes and unlocks the cell to allow glucose to enter. There's a couple of things that can happen. That key can become faulty. It doesn't work as well, or it can also be overutilized to where what used to only take a little bit of insulin requires a lot more insulin. And that is what insulin resistance is. The efficiency of insulin to do its job is not that great. And as a result, glucose builds up in the bloodstream. And we do not want that. And so the body senses high blood glucose levels, it will release insulin. It will continue to release insulin, or it should, until the blood glucose comes down. And so what we want to have instead of insulin resistance, we want to have insulin sensitivity. We want to be so sensitive to insulin that it gets the job done efficiently. And how does someone become insulin resistant? They age. It's just a part of aging, because these things happen that lead to insulin resistance as we age. People move less. The less you move, the more insulin resistant you become. People have less muscle mass as they age. The less muscle mass you have, the more insulin resistant you become. People have nutrient deficiencies. Deficiencies in things like magnesium, potassium can lead to insulin resistance. And then also people have poor sleep habits. This can lead to insulin resistance. So can stress. So a lot of things that are associated with aging increase the risk for insulin resistance. I also want to help to show you is that you don't have to age like everybody else. Everybody might be headed down this one path, but you're here and we're gonna create a better path for you. What should you do if you have insulin resistance, which everybody, in my opinion, does? Everybody has a spectrum. So if you are 10 out of 10, let's say the most insulin resistant, that's type 2 diabetes in my opinion. And then let's say 6 or 7 out of 10, that's pre-diabetes. And then maybe you're 1 to 6, maybe you're in a range, whatever. Most people as they age are getting closer and closer and closer to that 6 or 7 out of 10. And then next thing you know, they're 10 out of 10, they're type 2 diabetic. Let's not do that. Some tips to decrease insulin resistance in your life. The number one thing I would recommend that you do is you increase your protein and fiber intake. Eating sufficient protein and fiber will help you to feel full longer, and it does help to balance blood sugar levels. So in order to decrease the need for insulin in our life, in order to improve our sensitivity, we should decrease the amount of sugar we're consuming. That's all well and good, but where people get it wrong is they only focus on that. What you should do, in my opinion, instead is to focus on getting enough of the things that your body needs, and as a result, that will eliminate the desire for excess sugar. Of course, eliminate sugar, do whatever you need to do, but getting enough protein and fiber will significantly help. The second thing that I would recommend that you do is you always pair a carbohydrate with a protein. And what does that mean? Carbohydrates are anything from fruit to candy to cake to beans are a carbohydrate. And so I would always pair any type of carbohydrate with a nutrient-dense source of protein, a good source of protein. For an example, if you're gonna have dessert, have it after a meal that has chicken, beef, fish, something in it that has protein. As a result, you will greatly decrease the blood sugar spike associated with that meal. Continuously spiking your blood sugar, that spike always requires more insulin, okay? So what we want to have are soft rolling hills. We don't want to have spikes. We want to have soft rolling hills as much as possible. The next thing I would do is I would focus on sleep hygiene. Sleep hygiene means just like you have hygiene for your teeth, you want to have hygiene for your sleep. You want to have habits in place that prevent you from having poor sleep. Your circadian rhythm greatly impacts your blood sugar balance and your insulin. And so if you can get a good night's sleep, high quality, do things that help you to slow down at the end of the day, decrease your exposure to blue light, get morning light in your eyes, all these types of things, you will improve your sleep at night. That is a huge part. It has been shown that when people get poor sleep one night, they are more insulin resistant the next day. You're not crazy if you feel like you're craving sugar the next day after you only get 2 hours of sleep. Your body needs energy and it's more insulin resistant. I would also, most underrated thing is to incorporate stress management tools. High stress levels make people more insulin resistant, and that leads to disease. And so that is why decreasing stress in your life is one of the best things that you can do. The next thing I would do is I would have a daily steps goal. Walking is the easiest thing that you can do to decrease your insulin resistant status. Everybody, in my opinion, should be getting at least 7,000 steps a day. If you can add 1,000 more steps to your day, you greatly decrease your risk for all-cause mortality. What that means is you decrease your risk for death from any type of situation. And so the more you move, the more you use glucose, and the more you improve your insulin sensitivity. I would also incorporate resistance training. The less muscle mass that we have, the more insulin resistant someone is likely to become. Building muscle is very imperative as we age, and because of the muscle loss associated with aging, that is why a lot of people become more insulin resistant as they age, because they don't have as much muscle mass. So building muscle is very important. Well, the final thing I'd recommend is that you create hours of eating. When you are constantly eating throughout the day, meaning you're snacking, and then you eat again in an hour, and then again in an hour, again in an hour, again in an hour. Every time that you eat or drink something outside of water or something that doesn't have glucose, you are telling your body to produce insulin. Insulin is released. And if your body is constantly getting insulin released, what's that going to do to the sensitivity to insulin? It's going to decrease the sensitivity. If you are constantly having someone knock at the door, knock, 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 you kind of, after a while, it's annoying, but then you start to not hear it anymore, right? It just becomes a part of your life. Then if you have a silent home, no one's ever knocking, randomly someone knocks on your door, you're like, oh my gosh, someone's here. That's what we want your body to react to insulin. And so if we can cut back on the hours of eating, you will improve the sensitivity of your body to insulin. However, a note on intermittent fasting. I think that intermittent fasting is a fabulous tool, but it is not right for everyone all the time, women especially. And so I would take caution about intermittent fasting, and the reason is it is a source of stress. And if you are overstressed already and you add intermittent fasting, extended periods of fasting, you could add more stress to your life and actually increase insulin resistance. So when I say hours of eating, I mean a great way to do that would be stop eating after dinner, if that helps you, and then eat in the morning. Have really full meals to where you need maybe a snack in 3 hours rather than a snack in an hour. Build your plate sufficiently. You can decrease insulin resistance in your life. You can improve your health as you age. And I hope that this video helped you do that. If you have any questions on insulin resistance, let me know. I do have a video program all about decreasing insulin resistance in your life and helping you to age well and prevent disease. If you would like to learn more about that, I will link it in the comments. It is called the Insulin Resistance Fix, and it gives you 8 ways to improve your insulin sensitivity outside of just eliminating sugar. has helpful guides. And have any other questions about insulin resistance, or you would like to see a video about another topic, please comment below and take care.